Welcome back to Rook's Health. In this video, what we're going to be covering is specifically the health and care visa for adult social care workers in the UK. Now, this video will contain a very good overview of the important things you need to know if you are a social care worker coming from abroad and you want to get a job in the UK. Very important to know I am a physiotherapist by profession, and I've gone through this similar process, which is the health and care visa, very recently. So I'm very familiar with the system, but I'm not a social care worker. So most of the information I'll be providing is coming from straight from the Gov UK website, and just analyzing that as I've done with similar application. I'll let you know, so take that as you will. But this video will cover quite a few things ranging from governing bodies to where to find the jobs, as well as just are you actually eligible for the health and care visa. So let's jump into the video. All right, let's start with what you will need to know, which is the overview. The good overview is a health and care worker allows, the visa particularly allows a medical professional to come to the UK and to do an eligible job with the NHS, an NHS supplier, or in adult social care. So you can already tell the eligibility for adult social care is there. You are already eligible. Next thing is to know why that is so like that. And it's very important to know this because the NHS technically is not the primary driver for adult social care. Adult social care actually kind of works differently, and I know this from my time in the community where different councils are responsible to an extent for their social care. So it's not as though it's over the NHS, but they are governing bodies. It's very close affiliation. You will find some jobs within, you will not find some others. So that we'll get to that in a bit about where the jobs lie. But just so you know, it's councils, cities, different. It runs differently. It's not as centralized in that sense as people might think it is with just one NHS. But let's go into the next part, which is, apart from that, you want to know, is your job eligible? Now, this is the eligibility criteria here, but I won't use this one for the purpose of this video. I'll use what happens when you click on it, which is your job. Now, let us begin. The first part of this particular part, looking at your job, is you're qualified doctor, nurse, healthcare professional, adult social care professional. Now, this is the key word in this whole statement, which is qualified. Now, you could have studied adult social care or study something else, but you're not qualified. That's a different story entirely. How you get the qualification is by registering with your governing body. Now, a lot of people were thinking physiotherapists like myself, some other biomedical sciences, as well as occupation therapists, have their own governing body, which is the HCPC. I'll show you that in a second. Doctors, nurses have their own governing bodies. Social care have their own, but let's go into the HCPC. Now, a lot of people think it's the HCPC, but if you can clearly see on this website here, it says they work closely with other healthcare regulators to share best practice. That just means that they're not the guys you want to look for regarding specifically social care. So let's go down and find, you can see clearly here, social care regulators would be for England. This is if you were trying to practice in England, it would be with the SWE, which is Social Work England, and then you see Northern Ireland, Social Care Wales, Scottish social services. So we can see it already varies already. You can see how a bit segmented it is already. So it's not HCPC you'll be getting your registration from. It would be with this body. When you click on this link to try and have more information, which I do strongly recommend you come on, have a look at the whole website in itself, because I'm not going to go over that in this video. But what I will talk about is it's very straightforward. You would have to apply to join the register. When you join the register, that makes you qualified. That is the qualification that they're looking for to apply for the visa, and also the qualification you're looking for to apply for jobs, actually. So most people who watch these videos are coming from abroad. So you can see a small section here, which is if you're qualified as a social worker outside the UK and you're trying to come in. This is the way you're looking at. It just says before you start the application, you want to read more about the process, which I do encourage, so you know what it includes. The important thing is how to evidence your qualification as well as English language requirements. This in the second part we'll touch on a bit later, because it'll be very similar to the actual visa, what you need, which is how do you prove English language? Okay, so we'll touch on that later, but I'm not touching on this whole video for now about the application process, because I'll do that potentially another video specifically for HCPC. Just wanted to make you aware of the governing body for this profession specifically. Now, let's go back. Once you register, once you've applied to it, that's fine. You're good to go. Okay, that's one part. You're then qualified as a social care worker, adult social care worker in the country. Next part is you're eligible, your job eligible for this visa. We've already gone through this. Adult social care is eligible, but as a reinforcement of that, you come down here, you can see, check if your job's eligible. If you don't know the ONS code, I won't bother with all that specifically for now. Just come down to see off the bat. These are the professions which are the easier ones where basically it shows. Anything other than that, you has specific things you need to look out for, which, as you can clearly see, social worker 2442. Keep that code in mind because it might come later, very handy later on in your application process. But that one is very self-explanatory, which is your job is eligible for the visa. Next thing is you'll be working for a UK health and care sector employer that has been approved by the Home Office. Very similar lingo to are they allowed to sponsor your visa? That's more or less it's simple as that. Now, to know whether they are approved by the Home Office is where you would then go to the good old list of this, which is the Register of Workers, temporary and licensed sponsors. You just need to be able to cross-reference that wherever you're applying to, if you're finding jobs, if you're looking for that job, is able to sponsor your visa. Now, this list, I've done a video about navigating this list, so you can check that out as well. But this is basically, you go here and find cross-reference whether they are actually allowed to sponsor. And that basically means if they are, that's approved by the Home Office more or less. Now, the next thing you may be wondering is, so how do you get jobs? Because I have touched on this in a bit for NHS jobs. So let's quickly do a small brief segment on where to find jobs for adult social care. Now, as I said before, it is a bit different than just NHS jobs, where you go on NHS jobs website and you find almost every NHS job there easily. You might find some social care work there, you might not find, because again, councils vary. They offer different jobs council based, so it's actually almost a bit tedious. But there are centralized sites where you can find them. Some I've come across just recently is no, that's not it. It is so it's Joint Social Care. It help you find care worker jobs. This is one you can look at, but then there are also others. You can just go on Indeed, LinkedIn, the basic sites. I might do a whole video for that separately, but these are a few things you keep in mind as well if you're looking for them. But one thing I want to let you guys know is how councils work, which is, for example, take Leicestershire City Council. Now, you can clearly see this is where you want to work in the adult social care public health industry. Their care assistant roles, that's the whole different thing. I'm not touching that right now. But you see, it says basically each individual council, you see the services social workers they offer. This is one small, this is basically Leicestershire. And you can imagine it across the UK, there are multiple different councils. But the good thing is they run on, some of them have centralized databases. So this is coming to this one, which is quite a good one. I think if you're looking for, but this, again, East Midlands, there's West Midlands, there's a whole other different places you can look for. But it's one way, one place to start, giving you an idea. You can see there are many different jobs. Social worker, shows salary, shows everything. I'll put this link as well if you wanted to look at it. And as you can see on this right side, you can see the other councils, Nottingham City Council and social work. You get the idea. It's very council run. So that's very briefly where you can go and look for jobs in specifically social care, because you're not going to find all of them on NHS jobs, just so you're aware. But that's more or less that about specific jobs. And again, I might do a whole separate video on finding jobs for this type of thing, and other good places you can look to see the bountiful amount of jobs out there. But that's more or less the idea. Okay. Now, obviously, the next thing is, you're eligible now. You've gotten your qualification. Your job is eligible, which is social worker. And then you've checked and you found that, you found an employer. You've done the application. You're successful. Next question you need to pay the minimum salary or the going rate for this type of work. Now, I tried finding the going rate for specifically social work. It's a bit difficult, but normally if we come down a bit more, down, to salary requirements, and I have touched on salary requirements and how much it costs previously in the biomedical science video. So go and look at that. You need to usually be paid at least 20,480. If the going rate for your job is higher than 20,480, you need to be paid at least the going rate. I'll be honest, I don't know the specific going rates for social care work, so I won't touch on that. I'll just let you know this. Now, I did try and look if you can do further digging than myself on this video, which is each occupation code has their own. I did go through the ONS portal, popped into 2442. It wasn't very helpful specifically to me, but I would say this is something you can look deeply into. But something tells me in my heart that you should be fine if you're getting one of these higher paying jobs as social workers. From what it's looking like from a very, very lazy overview, it's looking well over 20,000. That's normally what you would expect. I could be wrong. Don't quote me on that one particularly. So I just wanted to highlight that particular point because I thought it was very important to know. You have to find the going rate to find the minimum salary if it's less than 20,000. Okay. So that's very, very briefly and kind of summary on this specific adult social care workers visa. Now, if there are specific elements, and I will do this over time, I don't want to make this video too long, but this is a very simplified overview on it because I've touched on it before already on the whole process. Now, it's very important to know, I'll summarize with this, is that adult social care in itself and healthcare workers visa comes under what is a new thing called the skilled workers visa. Now, previously it was known as Tier 2, which is what a lot of people know it as. It's recently been switched to skilled workers visa, it's name change, and then health and care workers visa comes under skilled workers visa. It's a type of skilled worker visa. So if you're not seeing, specific jobs or specific occupations, and you're not, it's not on this health and care workers visa, does that mean I can't apply? No, that's not what it means. It just means you have to go and look on the skilled workers visa, which I will do for some other occupations that I've been asked to do. But that's just more. But for social care workers, you're fine. It's clearly your job is eligible, so you should be good if you go through the proper steps. Now, in order for sanity, and so these videos should not be remarkably long, I will cut it into sections so you can then watch and see which is relevant to you. But I will also be covering in other videos how to show English, what documents you need to apply, as you can see here, and also more information about applying from outside the UK, which is majority of what people who watch these videos will be coming from, trying to figure it out. So make sure to subscribe so you know which other videos I'll be coming out with over time, and I'll try and do them more often as I can, just so you know more of the process, because I know it can be a bit daunting with the amount of documents you have to go through and everything. So make sure to subscribe. Check out for the next video. Take care.